think back to the last time you felt completely unstoppable. The kind of raw, physical energy where you wake up before the alarm goes off. You hit the gym hard, your focus at work is razor sharp, and your drive in the bedroom is exactly where it was when you were 30. Now look at where you are today. The gym feels like a massive chore. Your muscle mass is slowly melting away. Your energy crashes by 2 in the afternoon. And your libido? It is barely a fraction of what it used to be. You look in the mirror, and you tell yourself that this is just what happens when a man crosses the age of 50. You tell yourself that aging is undefeated. But what if I told you that you are being lied to? What if your sudden loss of manhood has absolutely nothing to do with your age, and everything to do with the plastic orange pill bottles sitting in your bathroom cabinet right now? Welcome to the Men's Wellness Blueprint. Today, we are exposing a silent epidemic that the medical industry refuses to talk about. We are going to reveal 7 incredibly common, everyday medications that are systematically destroying your male hormones. These are drugs handed out by doctors every single day to improve your health. But underneath the surface, they are chemically tanking your testosterone, crushing your stamina, and turning vibrant, aggressive men into tired, weak shadows of themselves. By the end of this video, you will know exactly which pills are acting as chemical castration agents in your body. Listen to me carefully. The medical system does not view you as a whole man. They treat isolated symptoms. You have a problem, they give you a pill. But they never tell you the biological cost of that pill. They never tell you that fixing a minor issue is going to cost you your testosterone. Today, we break down the blueprint. Let us expose the 7 testosterone killers hiding in your home. Drug number 1. Cholesterol-lowering medications, specifically statins. This is the single most prescribed class of drugs on the planet. Millions of men over the age of 50 take a statin every single night before they go to sleep. Your doctor told you your cholesterol is a little high, so he put you on a pill to crush it. But here is the catastrophic biological truth that they failed to mention. Testosterone is not made out of thin air. Your body manufactures your male hormones directly from cholesterol. Cholesterol is the fundamental, raw building block of testosterone. When you take an aggressive chemical to artificially wipe out your body's cholesterol production, you are literally cutting off the supply chain to your testicles. You leave your body with 0 raw materials to build the hormones that make you a man. This is why men on long-term statins routinely complain of profound fatigue, severe muscle weakness, and a complete loss of morning wood. You are starving your endocrine system. Drug number 2. Hair loss medications. Specifically, drugs like finasteride or Propecia. This is the ultimate vanity trap for men. You start noticing your hairline receding. You panic. You go to the doctor, and he hands you a pill that promises to save your hair. But he does not explain the biochemical nightmare that comes with it. These drugs belong to a class called 5-alpha-reductase inhibitors. Their entire job is to stop your testosterone from converting into DHT, which is the most potent, aggressive androgen in the male body. DHT is what gives you your masculine drive, your libido, and your sexual stamina. When you block it to save a few hairs on your head, you completely destroy your sexual function. Men on these drugs frequently develop severe erectile dysfunction, a complete loss of sex drive, and even depression. You are trading the physical performance of your manhood just to keep some hair. It is a trade no man should ever make. Drug number 2 leads us directly into drug number 3, antidepressants, specifically SSRIs. We live in a highly stressful world. Men are under immense pressure to provide, to perform, and to succeed. When the stress gets too heavy, doctors are incredibly quick to prescribe an antidepressant. These drugs work by flooding your brain with serotonin to keep you calm. But the male body is an intricate scale. When serotonin goes artificially high, your dopamine crashes. And dopamine is the molecule of desire, motivation, and sexual arousal. When your dopamine is chemically suppressed, your libido drops to 0. You lose the aggressive fire that makes you want to conquer your day. Worse, SSRIs are notorious for causing delayed climax or the complete inability to finish in the bedroom. Your testosterone drops because your brain is telling your body that you no longer have the drive to reproduce or compete. You become emotionally and physically numb. Drug number 4. Blood pressure medications, primarily beta blockers. High blood pressure is a massive issue for older men, and it must be managed. But beta blockers manage it by chemically forcing your heart to slow down. They put a hard speed limit on your cardiovascular engine. They block the adrenaline receptors in your heart. But a man's physical stamina, whether he is lifting heavy weights in the gym or performing with his partner in the bedroom, requires an absolute surge of blood flow. When you put a chemical governor on your heart, you literally cannot pump enough blood to your extremities. Your workouts suffer because you cannot push your heart rate up. Your muscles shrink because they are starved of highly oxygenated blood. And your erections become weak or non-existent because the blood pressure required to maintain them has been artificially shut off. You survive, but you lose all of your physical power. Drug number 5. Prescription painkillers, specifically opioids. Whether it is from a back injury, a knee surgery, or chronic joint pain, millions of men rely on opioids just to get through the day. But opioid medications do something terrifying to the male brain. They directly attack the hypothalamus. The hypothalamus is the control center in your brain that sends the signal to your testicles to produce testosterone. When opioids enter your system, they shut that signal off entirely. It is a condition called opioid-induced androgen deficiency. Your brain literally stops talking to your reproductive organs. Your testosterone levels fall off a cliff within a matter of weeks. Your muscle mass begins to waste away. Your bones become brittle, and you develop a soft, sluggish physique. You are masking the pain in your knee, but you are systematically destroying the hormonal foundation of your entire body. Drug number 6. Acid reflux medications, specifically a drug called cimetidine, often sold over the counter for heartburn. You eat a heavy meal, your chest burns, and you pop a pill to settle your stomach. It seems completely harmless. But cimetidine is highly unique and highly destructive to men. It does not just stop stomach acid. It actually binds to your body's androgen receptors. That means it physically blocks testosterone from doing its job inside your cells. But it gets worse. It also prevents your liver from breaking down estrogen, the female hormone. So your testosterone is blocked, and your estrogen levels slowly begin to rise. Men who take this medication chronically can actually develop enlarged breast tissue, hold excess water weight around their waist, and suffer from severe drops in stamina. You are essentially feminizing your body just to cure a little bit of heartburn. Finally, drug number 7. Over-the-counter anti-inflammatory drugs, like ibuprofen or naproxen. You take them when your joints ache or your muscles are sore. Taking one every once in a while is fine. But many men over 50 take them every single day like vitamins. Recent clinical studies have shown that chronic use of ibuprofen directly impairs the function of the testicles in adult men, leading to a state of compensated hypogonadism. This means your testicles have to work twice as hard just to produce a fraction of the testosterone they normally would. Furthermore, chronic use of these pills blunts muscle protein synthesis. That means every time you lift weights, the medication prevents your muscles from recovering and growing. You put in the hard work at the gym, but the pill steals your results. Your muscles stay flat, your stamina stays low, and your testosterone struggles to survive. Now, listen to me very carefully. If you are taking any of the prescription medications I just listed, do not go into your bathroom and throw them in the trash. Stopping medication cold turkey can be incredibly dangerous and cause severe medical emergencies. I am not your doctor, and this is not personal medical advice. This is the unvarnished biological truth that you deserve to know. Your next step is to become the absolute CEO of your own health. You need to walk into your doctor's office, sit down, and demand a conversation. Ask them about the side effects these drugs are having on your testosterone. Ask them to pull your blood work and check your free and total testosterone levels. But most importantly, ask them for an exit strategy. How can you use an aggressive diet, targeted supplementation, and a brutal workout routine to fix the root cause of your high blood pressure, your high cholesterol, or your joint pain? The modern medical system profits heavily from keeping men comfortable, weak, and chronically medicated. They want you on a subscription plan for your health. But true men's wellness is about building a biological machine so strong, so optimized, and so resilient that it does not need a chemical crutch to get out of bed in the morning. It is about fixing your diet to drop your cholesterol naturally. It is about strengthening your cardiovascular system so you do not need blood pressure pills. It is about taking your manhood back. You have a choice right now. You can close this video, go back to your normal routine, swallow your pills tomorrow morning, and watch your muscle, your stamina, and your drive slowly fade away. Or you can take control. You can decide that you refuse to accept weakness. You can build the blueprint. If this video woke you up today, if it made you realize that you need to fight for your health, I need you to do two things right now. First, hit the subscribe button. We are building a massive brotherhood of men who refuse to be average. We post hard-hitting, science-backed strategies every single week to keep you operating at your absolute peak. Do not miss the next video. Second, I want you to go down to the comments section and tell me your story. Have you taken one of these medications and noticed your energy or your drive crash? Tell the community. Your single comment might be the exact warning another man needs to read today to save his own health. Finally, share this video. Send it to a brother, a father, or a training partner who is relying on these pills. You have the power to change his life today with one simple text message. Your stamina, your hormones, and your physical power are your most valuable assets in this world. Protect them fiercely. Never stop optimizing. Stay strong, take action, and keep building your blueprint. I will see you in the next video.